Well, hello and welcome to WBGL Community Matters. My name is Jonathan. Always on this program, we like to talk about some of the most important issues in our community, in our families, for anybody. And today we're talking about one of the more difficult and emotional decisions that many families will ever face, and that is caring for a loved one with memory loss. And whether it's Alzheimer's, whether it's dementia or other cognitive challenges, families are often left wondering when it's time to seek additional help and also what quality memory care really looks like today. So we have a couple of guests in the studio. One of those is Dawn, who's the Community Resource Director for Amber Glen Memory Care. And we welcome you, Dawn. Thanks for being here.
Thank you. Thank you for having us.
We also want to say hi to Natasha, who is Amber Glen Memory Care Health Services Director, who works closely with residents and families that are navigating these deeply personal situations every day. Natasha, we've got you on the phone. Hello there.
Hello. Thank you for having us.
Thanks to both of you for just being dear friends of our ministry and helping us understand the signs to watch for. We're going to get into sort of how memory care communities like Amber Glen support residents and also how families can move forward having compassion and confidence. So, Dawn, I want to start with you. Just give us a little detail about the facility, where the both of you are based and what it is that you do, where you're at, and that kind of thing.
Yes, well, Amber Glen Memory Care is at 1704 East Amber Lane in Urbana, and we are the full-standing memory care facility. All we do is memory care. That's our expertise.
Okay,
so it's memory care and assisted living. And we are a secure facility, meaning it's a locked facility so that residents are safe.
Well, we had the chance to take a tour recently of your facility and meet some of the staff and some of the residents. And it sure seems that you like what you do.
I love what I do.
What do you like about it?
Oh, my gosh. It's the primary motivating force, as far as I'm concerned, is the peace that we bring families when there's, they're overwhelmed. There's a spouse that's the primary caregiver, and there's such a thing as caregiver fatigue, and it's a really serious thing. Their health ends up being in jeopardy.
Yeah.
And just in general, to give those with dementia, it's a very different lifestyle, but to give them the programming opportunities and the social interaction and the spiritual support and all of that rolled into their living, their life, a life of purpose and compassion.
As you were taking us around for the tour, you introduced us to a very special friend who did or is about to turn 104.
That's Charlotte French. Yes.
And she was very busy playing a game, but she took just a quick moment out to say hello to us. That was very nice.
She did. She's a lovely lady.
She seemed to be having a really good time. Natasha, I want to come over to you and just ask, for families that may be seeing some signs of memory loss for a parent or a loved one, but they're thinking, well, is this really enough to make a phone call about this? What are some of the first warning signs that concern you the most?
Well, thanks for that question. So for families with parents that have dementia, the warning signs that they should really seek help is when there is increased confusion, falls. They're not they're mismanaging their medications or mismanaging their bills and neglecting their hygiene. And also, if they're at home by themselves, if their home is messy and not safe, that's where you should seek support or consider looking for communities like Amber Glen.
Yeah, and I imagine that even though I have not had the chance to have to make these kinds of decisions for myself, I certainly have talked to those that have, and I know that some adult children will feel some sense of guilt about having to move a parent into a care community, and I'm wondering what you would say to somebody who is struggling with that kind of decision emotionally.
Yeah, it's definitely a tough conversation. I understand, especially if your parent is independent and also seeing them go through the disease and losing themselves. Most advice I tell families is start the communication early. Be supportive to your parents and understanding. Involve them in the process. Talk to them about the changes you're seeing and letting them know that it's not your fault and that it's a disease and you just want them to be safe. And it's not about you taking away their independence or not letting them have a say in their lives. They should approach the conversation with empathy with their parents and listen to them, basically.
Yeah, that makes a lot of sense. Dawn, I'm sure you've had a lot of chance to interact with families as well. Anything you'd add to that?
Yes, I would just say that it's primarily, even though their parent or a spouse, brother or sister is independent, it's a matter of their safety, and it's an absolute matter of their joy and purpose in life. And so it is a tough conversation to have, especially when they're extremely highly functioning and highly cognitive and are very much aware of what's going on. But the conversation, as Natasha said, really needs to be early and communicated in collaboration with their primary care physician.
Yeah. Natasha, I'm wondering, as far as the safety and dignity of residents who may be feeling confusion or anxiety or feeling, afraid of going in, I'm just wondering, how does a memory care facility create, that safety and dignity for your residents?
Our staff here are trained on how to handle certain behaviors or challenging changes that comes with the diseases, okay? And also, we have directors in the building that are also highly trained and are present in the community. We involve family in the care of the residents, and we support them here in this environment for them to thrive.
I believe that you said that all the residents in your facility are for memory care, and it's not like there's just a part of the facility for that. I'm wondering if there's a family that's trying to think about, it would be more convenient because maybe it's closer to home to go somewhere where the memory care piece is not in place, but what are some of the risks that they might face if they're not in the right kind of place?
The risk that they might face is dealing with medical needs, okay? So if you're not in the right kind of place, we're having behaviors that cannot be managed by our staff here. So, for example, we'll say behaviors like aggressive behaviors where they are harmful to themselves and others. That is something that we cannot manage here. We'll have to send them to a geri psych place and
and definitely just, there's no upside in not telling the truth about exactly what it is that's going on in the family so that they can get the best care that they can. Dawn, any further thoughts on that?
Yeah, I would like to mention that there's another aspect to behaviors, and that is elopement risks. And so that's the benefit of having your loved one admitted and placed in a locked facility. But often that is a behavior associated with dementia. And 1 in 3 older Americans are diagnosed with and will pass with dementia. So it's a serious, complicated journey for the families and the individuals. And so I'm a certified dementia practitioner, as is the majority of our leadership team.
Wow.
And that's very dementia focused.
Yeah. Well, those statistics are staggering. In fact, according to the Illinois Department on Aging, and of course we broadcast into Indiana as well, so Indiana would have its own stats, but what we're seeing here is that over 250,000 people in the state are living right now with dementia of some sort. And that just kind of tells you about the need that exists. And when we talk about the needs of our community and the issues that are here, well, that's sure one of them. We're talking with Natasha and Dawn today from Amber Glen Memory Care. I wanted to ask you, Natasha, that as far as caring for someone who has dementia, that can be absolutely exhausting for spouses and family caregivers. And I'm just wondering what kind of burnout or stress you might commonly see in families.
Well, what I see with families is they make decisions quickly without, taking the time to find the best support for their loved ones, okay? So, for example, when an aging parent happens to have a crisis and finds themselves in the hospital, and a family member who hasn't started the conversation early about how can I keep my loved one safe while ensuring that, they're having the best quality of life. And now they're at the hospital, and, having a loved one in the hospital creates a lot of stress because there's a lot of information here and there. And then now you are in a position where a doctor is telling you, at this point, this is where your loved one has to be. They cannot go home. So caregivers, like caring for parents with dementia, if if they don't recognize this early signs, like we talked earlier, and act upon it quickly, that's where the caregiver burnout happens, because you haven't acted quickly, basically.
Yeah.
Caregiver fatigue is so serious that often families utilize our respite program, where they can bring their loved one in, and there's a daily rate, and they're basically treated as if they're a full-on admission and placement, and they take advantage of our programming and our social interactions and events, and it allows the family member to take a break or go travel or seek medical attention of their own. And then that also gives them a chance to see how their loved one adapts. It's a minimum of 2 weeks, but it's
2 weeks. Okay.
Yep. Okay. Because then they get the full advantage and the benefits of that transition and that rest.
What misconceptions about memory care have you experienced along the way? We can start with Dawn and move to Natasha.
Say misconceptions is that dementia only exists or is diagnosed in those that are older, because we're seeing more and more these days younger, like into their late 40s, 50s, being diagnosed with dementia. So I think the misconception that it only affects those that are elderly is not accurate.
Yeah, that makes sense. Natasha, anything you'd add to that?
Yeah, Dawn has said it. That's that misconception that it's part of normal aging, and that's not accurate. Dementia is a neurological disorder that progressively affects the brain, and it can happen at any age. Now, it's not when my parents is 70 or 80 years old. It's now starting from early as 40 years old.
Wow. I guess the last question I'd like to ask on this topic is, what encouragement would you give to somebody that's in our listening area who may be at the just very beginning or even before the beginning of this journey with a parent right now, and they just feel very overwhelmed or unprepared and they don't want to make the wrong decision? Kind of like, what encouragement could you give them?
I would encourage them to do their due diligence and do the research and identify the ratings of the various communities, and primarily to arrange tours. You really have to experience the organic chemistry with our residents.
Natasha, you want to close us out? Any further thoughts on that?
Well, I'll also say that, like Dawn said, they should also research online and support groups. So weekly on Wednesday. So that's something that they can come in and meet other loved ones that have families going through.
Yes, thank you for saying that, Natasha. That's absolutely right. We have a support group where we partner with Family Services of Champaign County, and other counties that they represent. So we meet on the second Thursday of the month in Monticello at the Brown Bag, and then we meet the third Thursday of the month at 10 a.m. at Panera.
Well, we'll have that information here at WBGL in case anybody missed that today, but really good to know that that's happening. Our guests today have been Dawn and Natasha, both with Amber Glen Memory Care in Urbana. I appreciate both of you just for your insight and compassion as we've been discussing this important issue of memory care and caring for aged loved ones, and in some cases not so aged loved ones, dealing with this and helping families navigate some very difficult decisions. So thanks to both of you, and we appreciate what you do very much.
Well, thank you to you, Jonathan, and to WBGL to raising this issue and bringing it to light.
Absolutely. Natasha, thanks for joining us. Thanks for your help.
Thank you, Jonathan.
Absolutely. Well, this has been WBGL Community Matters. We thank you for listening, and we'll see you next week.